So hi everyone, I am Carmona from BSN2 Weiner. So the drug that I chose for this tabulation is epitine alpha, which is the drug for anemia. It is used to treat anemia, a lower than normal number of red blood cells. This is with people with chronic kidney failure. So the drug that I have chosen again is epitine alpha. The mechanism of action of this is the therapeutic class, which is the colony stimulating factors. The drug class is recombinant human erythropoietins. Lumoa is function as a growth factor and as differentiating factor enhancing the red blood cell production. So for the indication, the treatment of anemia, especially renal anemia from renal function insufficiency, including hemodialysis and non-hemodialysis of chronic renal failure. So the contraindications is the patients with uncontrollable severe hypertension, those with allergic to epitine or to other erythropoietin agents, those with combined infection should be cured before eposino is administered. So for the side effects, for the central nervous system, this side effect is asthenia, dizziness, depression, fatigue, headache, insomnia, paresthesia, pyrexia, chills, and seizures. So for the CV, it's the edema, HTN increased clotting of arteriovenous graft, vascular occlusion, and DVT. So for the ENT, which is um, the pharyngitis, for the GI, which is the gastrointestinal tract, the diarrhea, nausea, vomiting, and stomatitis. For the metabolic is the hyperglycemia, hypokalemia, hyperphosphatemia, hyperuricemia, and weight loss. For the musculoskeletal, the side effect is arthralgia, myalgia, bone pain, muscle spasm. For the respiratory, which is cough, shortness of breath. For the skin, the injection sites reaction, rash, and urticaria, pruritus. Lastly, the nursing consideration for this is first is to verify the physician's order. Secondly, observe 12 rights of medication administration. Of course, that is important. So third is before starting the therapy, evaluate patient's iron. That is the important one. Iron status. Patient should receive adequate iron supplementation beginning no later than when epidemic treatment starts. And continuing throughout therapy, patient may also need vitamin B12 and folic acid. Fourth is you need to monitor the BP before therapy. Most patients with chronic renal failure have HTN. So BP may increase, especially when hematocrit increases in the early part of the therapy. Fifth is the institute diet restriction or drug therapy to control BP. Sixth is monitor HB level twice weekly until it stabilizes in the target range and maintenance dose is established. Then continue to monitor at least monthly. So just resume twice weekly testing after dosage, any adjustment. 7 is monitor blood counts. Elevated hematocrit may cause excessive clotting for patients with chronic renal disease. So you need to monitor the HB level weekly until stable and then at least monthly. 8th is patient need additional heparin to prevent clotting during dialysis treatment. Lastly, drug increases risk seizure in patients with chronic kidney disease. Monitor closely for neurologic signs and symptoms. So for my scenario for this one, a 30-year-old woman was referred to our institution for evaluation of anemia. So the patient began having recurrent episodes of severe anemia with hemoglobin values as low as 3.5 gram per deciliter. She had become transfusion dependent and had received about 30 units of packed red blood cells in preceding 3 months. The physician prescribed epinephrine alpha 4000 IU subcutaneous per needed. The nurse is required to make the tabulation.